Okay, let's talk about priapism. Priapism is an erection that lasts for over 4 hours, and it is a medical emergency. So we'll talk a little bit more about the management of it, but first we'll talk a little bit more about what are the causes of it. Um, One common cause is medications, and you often see it on the commercials for Viagra or Cialis, but that's actually very rarely the cause. Um, More often, it's related to psychiatric medications, especially antipsychotic medications. Trazodone for sleep is the most common one, but there's a long list of medications that have been associated with priapism. The other common cause that we see is cocaine abuse. And it's odd, there's a lot of people that do cocaine, and most of them never have priapism. And some people have done cocaine for years and never had an issue, but one day it happens to them. And we don't fully understand why it affects some people and not others. Maybe it's some combination of cocaine and other things that they're taking, but cocaine is definitely a cause of priapism. Another one is injections that we give people for erectile dysfunction. They're specifically designed to give people an erection, but if they give themselves too high of a dose, or if they take an injection where they never really needed it, the erection might not come down. So whenever we prescribe it to people, we tell them to give as low dose as possible that will get a functional erection. The gas station pills can sometimes cause this because we don't know what's in them. I have other videos talking about that. Another cause is sickle cell anemia or other types of blood disorders. Basically, when the blood cells sickle, they can induce a priapism event. Um, this can be a recurrent issue for these people. And so if you are somebody with sickle cell anemia, then that's something to be aware of and make sure you have under control. And then sometimes we never really know what caused it. I don't know if those are people who are just denying the drugs that they took, um, or what, but they just seems to happen. Now, if you do have a priapism, it's not that big of a deal as long as you get it treated right away. So at that 4 hour window, the injection that we give you to take away the priapism works really well, and it's pretty easy to do. It doesn't have to be a giant needle. It doesn't have to be a large amount of medication. Basically, this medicine causes the blood vessels in the penis to constrict, and the erection goes away, and everything goes back to normal. It's obviously not a fun experience, but it's not the end of the world or anything like that. The problem is that a lot of guys want to wait to see if it will go away on its own because they're embarrassed or what have you. And that's when you get into serious danger of permanent damage. Because once you have an erection that's been over 12 hours, you're likely going to have some permanent erectile dysfunction from that. And it's going to be a lot more difficult for us to get it down. And as that extends beyond, say, 48 hours, you're pretty much guaranteed to have permanent erectile dysfunction. The idea here is that during a flaccid state, the penis has blood flow in and blood flow out. So you get fresh blood with oxygen delivered to the tissue and CO2 and other things leaving. When you have an erection, the blood comes in, but it doesn't really come out. And so an erection is naturally sort of an ischemic state or a low flow state. Now, that's fine. The tissues are meant to tolerate that for up to a couple of hours. And once you get beyond 3-4 hours, now you're getting to a state where the tissues are not getting oxygen. And that can lead to permanent damage, especially once you go out past 48 hours. It's basically dead. And it's not dead like the penis is going to fall off, but it's dead like the inside will become all scarred and you won't be able to get erections anymore after that. So if you take away one thing about priapism, is that if it happens to you, do not wait for it to go down on its own. You need to come in right away to have it treated. I would say once you hit the 3 hour mark, probably start making your way into the emergency room. There's a lot of things online about different things that you can try to make it go away. on its own, but none of them really work that well. So you just need to come in and get it treated. In the emergency room, if it's been, say, past 6 hours, sometimes it can get to be really difficult to get these things to come down. We often have to put a pretty big needle into the side of the penis to drain some of that blood out and inject this medication multiple times to try to get those blood vessels to come down. But if we can't get it down that way, then we have to take you to the operating room to get it down. Or actually making bigger incisions into the penis to get this old blood out. And now again, you're looking at serious long-term consequences of that. Then there's different types of incisions that urologists talk about, and different details that you don't need to really know as a patient. You just need to know that you don't want that to happen to you. And in some severe cases where patients really waited over 48 hours, we just go straight to putting in a penile implant, typically a malleable penile implant, because we already know that they're going to have permanent erectile dysfunction, and it's better to put the implant in now as opposed to later after that tissue has all filled up with scar. And that's not something you want to have done in an emergency setting. You have higher risk of infections, and it's a shame to have an implant put in if you never needed one. Priapism is a little bit complicated because there's a lot of different causes of it, but they all come back to the point that this is a medical emergency, and if it happens to you, you definitely should not wait. You should come straight to the ER to get it treated.